Well, thank you for leaving the floor and inviting me for my presentation, and I would like to guide you through prison services, and we heard a lot about this morning. Why are prison services, and I include all forms of deprivation of liberty, are so important for infectious diseases? Well, all or most people come from society and go back to society. And then we have a hot melting pot where they deal with each other, and in this situation we are. So, first problem. When we look at the numbers of inmates during the states of the European area, we will find that there is a main problem. We have huge differences in numbers of inmates. So, from Scandinavia, we have numbers under 100 per 100,000 to Russia, where we have about 500. And this shows us, as already said from Eric, that there is a big problem in decision who is going into incarceration. And when we reduce number of inmates, we will reduce number of problems of infectious disease. And this is main part, and I could stop here, but I will go a little bit further. So we need alternative forms of punishment which will reduce risks of infectious diseases. And I will skip away one specific part which is always named in combination with deprivation of liberty, which is overcrowding. When you look at overcrowding, you see that the areas with the highest numbers are not those who are mainly overcrowded. And I will guide you to the next problem so far. These are data from the German statistic area, and we have low numbers of inmates, and now you get the problem. When you go to the basis here, you will see that most of the inmates have very short time inside the prison system, and this will guide you to the main task you have during incarceration, which is resocialization. And when you think about resocialization, you have other items you have to deal with except medical and addictional and infectious problems. So you have to deal with the criminal faction, you have to deal with the social section, you have to deal with the financial situation of the inmates. So you will have to share the time you can work with the inmate with all other problem areas. And by this, you are in a bad situation overall. You have to deal with so many problems, I will point out a little bit later. I will give you some imagine how we are dealing with, and now I use data from the Berlin State Service. You must know Germany is dealing with 16 states called Länder, and overall in the world, you see that only about 5% are female, so we are mainly thinking and dealing in prison house with male persons. And you see we have a first problem, which is we are a metropolitan region, so are we quite different from Finland or other areas where you have very bright countries, and then you have always lower numbers of inmates. And I will guide this to a number of physicians. Well, I could contract physicians, but I don't get them. And I hear it more and more in most of the countries, and this is a problem fighting against infectious diseases. And it's even getting worse because the market for health professionals is empty. And what we are doing is, and this is not nice, but we are contracting them from the East because they have low payments there, and your situation here will get worse. And the same is not only for doctors, the same is for nursing staff. So I will go on. We have to achieve equivalence of care. Do we really do? Well, I say for Germany and for Northern Europe and for Benelux states, Switzerland, Austria, and Spain, France, and these countries around, we have got it. but we have not that many limits in budget. And this is one important factor we already heard again from Eric and this morning from WHO. If you don't put enough resources into the system, you will get into trouble. So by this, we have another problematic situation in prison health, and this is a responsibility. Who is responsible for prison health? And the northern countries started to skip this from the Ministry of Justice to the Ministry of Health. And this is an important idea to make it better and to achieve equivalence of care. So this is the next step we have to do during the line of all tasks which have to be done. So again, and I will point out very specific thing here. We are looking at the society when we look to inmates. In the society, you will get crimes, and all these persons will sent to the court, and some of them will convicted. So I'm talking about remand prisoners and general prisoners and other forms. So you get a prison population, and inside this population, as similar as this in society, but more higher numbers of addiction will be the problem. And this is overlapped by infectious diseases. So far, we already have heard during the day on several times. But now I will add another factor. This is mental disorders. And you left this out for the whole day from my point of view. But this is a group suffering from mental disorders. We know from studies that we have about 85% of prison inmates with any type of mental disorders. And there might be a specific reason that they get criminal, that they get addicted, and by this they get infected. So please keep in mind there is an additional factor you haven't spoken about during these meetings, and I haven't heard in the conference I have discussed this morning with a colleague from WHO. So very, very important situation. Mental disorders are very close linked from our point of view to the situation of infectious disease. So what do we get into inside the prisons? We get severe, partially life-threatening withdrawing symptoms we have to deal with. And in this situation, normally a patient or a person is not or is undergoing much, much higher risk to get drugs, and this is a point we have to deal very early with. We get an exacerbation of mental problems on admission. Again, this increases the risk that you get risky behavior regarding infectious disease. We normally get extremely poor dental health, and we know that from dental health we have infectious problems to other organic systems in the body. Quite often we get increased immune status, which makes more violent for infectious disease, and quite often you won't know what the health status is. And quite often you have a loss of total medical records and documents, even vaccination charts or anything else. So you have no information about diagnosing and care process, and you have deferred medical problems. And this is where we start when we admit someone to prison services. And this shows that you are dealing with infectious diseases. So we have some challenges, and on my the name of my presentation, TB, was left out, but I added it. I hope you agree, because I have some ideas we can do a proper approach. And the first thing is that I vote for still total X-ray examination on arrival, because we can reduce the numbers of TB outbreaks to zero inside our prisons. Then you need, everybody knows, consequent treatment, and you must isolate those who are smear positive, all these normal things. But the starting point is that in quite a few countries, it's still only that you take a smear and diagnose a smear positive. And by this, you are not that lucky to find all these cases of tuberculosis. Because what do we achieve? These are Berlin dates, very actual from 2015. We have to report to the health authorities. We did over 7,000 chest X-rays. And we must take into account we have about 4,000 inmates per day, so we have a high turnover, and we had about 45 suspicious cases, and we only found 21. But after that, no TB turned up. We detected 19 at admission from these 22 treated cases and smear positive cases, and we did resistance testing, and we only got 2 which are incarcerated during they have already been diagnosed and under treatment, and so far we have no problem with MDR in German prison systems. This is quite a good situation. So I go to the next challenge, HIV. Prevalence in German prisons is 1.8%, and we don't have any needle exchange programs except one in Berlin female prison in Germany, whole Germany. So we don't need needle exchange for prevention inside prison system, I could say, but I don't want to go against the procedures of harm reduction because they are helpful. They are more helpful outside. We need testing, and we need the whole situation of procedures, but we should focus just on needle exchange. And still, with this number of 1.8% for the moment, and this is higher than in the last survey we had, where the number of IV drug users is 80 times higher, HCV is 30 times higher, and HIV is about 20 times higher than in the community. We are on a good way, but we have left the situation where numbers are going down, especially on TB. TB is going up. And as we already heard, another method of infectious disease prevention on bloodborne disease is OMT, and we are on a stable level inside prison so far, but we have a decreased number of inmates, so the percentage of treated inmates is mild going up. So, some other data, we already heard a lot of information about the situation between addiction and between infectious disease, and about the close link between these two situations. And we have very new data in Germany. We did to the 31st of March this year a national survey on all inmates on one day on ICD diagnosis, and I got the data already for Berlin so far, and I put it out, and we still found that the main drug is not alcohol inside prison. The main addiction is so far opioids, and we all know this is a situation that opioids, when you get shortage or you want to get strong effects, you will get injections. So alcohol is about 170 cases, and opioids are higher, and the blue columns are showing the total numbers far left here. And you see alcohol is lower, as blue is addicted, and red is misused. All the F10 and following groups till F19 over here. I just lost the pointer there. And there is a big part of polyvalent use. This is situation in prison and evaluated using medical diagnosings. So it's not just a social worker situation, it's medical diagnosing, and this is quite interesting. So there is a real challenge here that we have to deal with opioids, and what we get, like all other speakers already reported, the new, very strange psychoactive substances, and we have cases now of death caused by synthetic cannabinoids from single use. Next challenge I had to speak about is HCV. Again, we have quite high prevalence, but this is overall prevalence. It's not under IV drug users. And we have this might be an underestimation because we have voluntary testing. We have no mandatory testing in whole Germany, and we are facing the problem that inside the system there is still a lack of money for treatment. So we know all that HCV is a curable infection, but we have not enough resources overall in the world. And we have a very specific problem. So I knew from my colleagues in Italy that they pay for one patient, one treatment about 25,000 to 30,000 euros. We in Germany need to pay 60 to 70,000 euros, I know. So this is main part of prison health, and so I have to come to an end. We have some other infectious diseases, and we have now some measles outbreaks in Germany. Sometimes we have neuroviruses outbreaks, so these are our problems. But we don't have resistant bacterial infections inside prison, and I'm quite happy about that. Where do we focus on? We focus on preventive medicine, but we are not that far going, and we are mainly going to treatment when there is an infection already given, and we could do more in this area. And I would like to come to an end and give you some take-home messages, and I would like to read them down. Medical care plays an important role fighting infectious diseases and needs cooperation with prison services. Prisoners come, I already said, and I can only repeat it, from society and go back to society. Medical care is also an important part of the social rehabilitation, and I focus here on addiction, and so you need medical care as an important factor in prison health. Medical system is, again, and additionally, an important role in prevention of torture, and we never should forget it, because even by this there is a risk for infectious disease. Prison medicine has to follow all new developments, so equivalence of care is not only the same level, it's also renew procedures and follow guidelines. And the main challenges will stay for quite a while, which are addiction, mental disorders, and infectious disease. Thank you for listening.